Hello, thanks for joining me. I'm Dr. Julia Overstreet. I want to thank you for coming to this introductory lesson in podiatry bits. You can see that these bits have different shapes and they will have different materials as well. So think of them in terms of what shape would achieve the goal that you're trying to do. And in terms of materials, we have carbide bits, the titanium aluminum nitride bits, and the diamond bits. These also come in more or less coarse shapes. So let's look at some of these now. We're going to start with the large cone. This happens to be the titanium aluminum nitride, but it doesn't have to be. I'm looking more at the shape of the burr. This is pretty universal. And by the way, that red on these nails is not blood, it's fingernail polish. So don't worry about that. It's just fingernail polish that we didn't get the rest of it off with the remover. The titanium aluminum oxide, or excuse me, nitride burrs are special because this coating that they have on them is something that makes it much cooler and it doesn't build up the amount of heat that the other burrs do. And that makes it particularly good for some of our more sensitive patients and clients, like the diabetics and the patients and clients with poor vascular supply. But you can see how I'm using this in the way I would use almost any other disc or burr to thin this, to smooth it. You saw a second ago I used it closer to the point to get some of the more proximal area trimmed off. I'm also using it on the skin there a little bit. These are all very skin friendly. And because it doesn't build up as much heat as the regular burrs, it again is great for our high-risk patients. There again, you see me using more of the tip of it there in the corner. I'm smoothing, I'm kind of shaping, taking a little bit of that dry skin off. It works great on calluses. You can press a little bit harder to take more off. You can also use these at a higher speed. I think I'm using this at about 25,000 RPM. Those of you who may have been using discs in the past, those have to be used at a lower speed. They're great, I still use the discs, but they need to be used at about 7,000 or 8,000 RPM. These more professional burrs we use much higher. We let the burr do the work. We don't have to press as hard. And that makes it a much smoother job and much less traumatic to the toenail or your efforts to take off the bulk of it. We're using the Aurora vacuum sander here, and you can see all that sand, all that dust that's being taken up into the vacuum. You can see it kind of stream to where that light is on the handpiece. So it can be used to thin, it can be used to smooth. This is a pretty universal shape, this cone. And again, you can use the same cone in any of those materials we discussed on skin as well as nails. Let's move on now to a different burr. This is also one of the titanium aluminum nitride, but this is a narrow cone. And so I'll repeat again that this cone shape, the narrow cone, is what I want to focus on right now. It's great that it is the titanium aluminum nitride, but because of the coolness effect, but it's the cone shape, the narrow cone I want to show you. You can see this does get down into those corners a little bit better. I'm just resting it there and up, resting it up. I'm letting the burr do the work, and that is another advantage of having it at the higher RPM speeds on a lot of your sanders. I'm pressing and letting the burr do the work. So you can go up and down like that, keeps it in the area. And again, I'm going up and down because even though this doesn't create a lot of heat, I am used to giving the areas a little bit of time to cool off. So that's a good practice anyway, even though this might not build up as much heat as some of the other burrs. But how nice that narrow cone does getting into the corner there. We have a narrower burr that we'll show later to get into even smaller edges. But this one looks great. I'm getting that corner off, just kind of smoothing it, taking it down to skin. It's kind of an art project at this point, isn't it? We're going to smooth it and shape it, make sure that it stays healthy and doesn't catch on socks or anything else in the couple of months between times we see this patient. This is a wide nail, and that width presses into the skin. And although it hasn't become actually ingrown, this particular patient or client does feel it. They're not neuropathic. So getting this corner, or excuse me, this side out a little bit more creates a lot less pressure there, and the patient is more comfortable in shoes. With this particular toenail, I can't actually cut it with clippers down the side because the nail is attached to the skin underneath. It's definitely quicker to use a clipper to go a little bit down the side, but if it's attached to the skin, it just makes sense we can't get the clipper under there without causing pain and bleeding. So coming from the top with an appropriate shaped burr is what works best. Least traumatic, doesn't create any bleeding, and accomplishes the goal of clearing that margin out to relieve some of the pressure. This works really well on calluses, but as you can see, this is just a little thin skin. It's a little bit harder to get that off, so I'm going to give up in just a second because I don't want to create any trauma. That can stay there. I was trying desperately to get it off, but it doesn't want to cooperate. So I'm going to go back to the nail. This bit or burr, those names are a little bit interchangeable. You saw me use it on the tip there a minute ago. It does have active motion on the end there. The activity of it continues onto the tip. Sometimes that's not true. Sometimes the tip of a bit is just flat and doesn't accomplish anything. But on this one, it does have the effects we want, even on the tip of it. Now I could be using that larger cone that we used on the last section for this too, but this is a tinier toe, and so maybe that gets in your area better. But don't think there is just one burr for any given job. I want to give you an overview into how you might choose different shapes of burrs for different things. See, this foot just has all these little pieces of skin, and you can't pull it unless it's just ready to go, because that might tear it and cause some bleeding, and we never want that. We're not really going into the corner here like we did on the great toe. We're just sort of smoothing things out. On the lesser toes, you don't have to go into the corners unless that is a corner that happens to get ingrown. But here we're just making it smoother and less likely to catch on socks. This does a great job. But the tip of that larger cone would have done that too. Remember, the larger cone narrowed down to more of a point, so we could have done the same thing with that. You'll learn to be versatile in what you're trying to accomplish with the different bits. This is a little area, we don't know what it is. It looks like dried blood to me, but before we do anything, I'm going to take a curette and gently explore it. I'm not going to try to lift it up or pick it up. I just want to press on it a little bit with the curette and just see, is that really an old injury, dried blood, or is it something new underneath there? I'm not trying to lift it up. I'm just pressing down, and that seemed hard to me. It seemed like it was an old injury. So we're going to use that same narrow cone to sand off that remaining dried blood and the sharp nail that's underneath. This was probably something where the patient stubbed their toe or it ripped off in a sock or something. This was a trauma, minor trauma that had happened since their last visit. So we just want to clean it up a little bit. But you notice I did not do that with the curette. It is attached to the skin, and doing anything other than gently explore with the curette would be absolutely inappropriate. I just wanted to assure myself that it wasn't moist underneath or an active wound of any kind. See that little piece that flew off there? We're just cleaning it up, that's all. We don't want it to catch any further as it grows out. I'm sorry, the light that's on this particular Auroria sander does get in the way of the photography sometimes. That's why I'm trying to move the handpiece away from time to time so you can get a better view of it. The light kind of impedes the photography. All right, let's move on to a barrel. Now this is a diamond burr, so it actually has diamond flakes on it, or chips, I'm not sure, dust, I don't know. But it's medium size. This one does have the diamond material on the end of it, so you can see me here. I'm actually shortening this with the barrel. It's diamond, and because there is diamond on that end of it, the distal end, I can use it to shorten and smooth that distal end. And then I can use the side of it to thin it some more, to shape it some more. Some of the things I was doing with the other previous two burrs, and that's what I mean. There's no one perfect burr. You need 2 or 3, maybe 4 or 5 in your kit, and you'll learn to use those to accomplish all of the different tasks that you need to make the nails the result that you want. With these thick nails, I like to shorten them with a disc or a burr or something rather than try to cut them. It is faster, and you have automatically a smoother, better shaped distal edge than with the clipper. And there's no risk of cutting them as there is with the clipper on these thick nails. We are touching the skin with this. It doesn't hurt the skin, as you can see. And yet I couldn't use it on calluses by just holding it on each section a little longer, moving it a little more slowly, maybe using a coarser grit of the diamond burr. These come in fine, medium, and coarse grit. This is a medium grit. Again, you see me shortening it there. I'm pressing and lifting, pressing and lifting. I'm not going back and forth. You can do that too aggressively, and maybe you would abrade the skin a little bit. So I touch and lift, touch and lift. Again, that red stuff is fingernail polish or toenail polish. It's not blood. All right, just some more with that medium-sized and medium grit diamond barrel. By the way, those numbers, in this case number Q, that's the reference number on our Rainier Med website if you want to get more information on this burr or any of the burrs. I'm using it now on the side to thin that corner, that edge. So I'm doing this a little differently, but accomplishing much the same thing I did with the other burrs in the edge. I'm thinning that nail, either all the way to skin or thinning it so that I can use the clipper more effectively. And I'm moving back and forth between the two, the medial and lateral edges, because this is a diamond burr, not one of the titanium aluminum nitride, so it builds up a little bit more heat. So I move it a little bit more, let the one side cool off, go to the other side, and then come back. It's not enough heat that it literally burns them, but it definitely feels uncomfortable if the heat builds up. And I'm pointing to the fact that it's a little more squared off and a little rougher there on the distal edge, so I'm smoothing it off. Kind of more of the same. Again, not all burrs or bits you can use the distal end, but on this one there is diamond grit on the distal end. That makes it very versatile. I'm smoothing it now. When I'm shortening it is when you see me touch and lift like that. When I'm smoothing it is when I go back and forth. So touch and lift as I'm shortening it. Touch and lift, touch and lift. And now I'm getting some of the rough spots off. So this I can go back and forth. Getting that edge down there. That's a sock catcher edge on the lateral side there. You can just imagine that's the place the sock would catch. So I want to make those lateral edges particularly smooth. These are crumbly nails, so we want to get them nice and smooth. They'll crumble more after they leave you, so get them as smooth as you can. All right, the next burr we're going to look at is the diamond burr that's called a pear. It is a little bit bigger than some of the pieces we've been seeing, but it has a lot of usefulness. So this is one of the nurses in our class, and she is learning how to use this new burr, as a lot of us are. A lot of them are new to us. And she's being very, very gentle with it, which I certainly applaud. But this is fairly skin friendly, these diamond burrs. So she's kind of getting a feel for what she can do and how much it takes off with any one little swipe. She's also learning, as you can see, that she can work on the skin itself. There were some rough areas, some calloused areas right there on the skin. And she's learning that she can take some of that off with no problem. You can kind of see the nail dust coming up there into the vacuum. But she's not getting a lot done. She's very timid with it, even though she does a great job with other bits that she's more used to. See, she kind of gave up on that nail, is moving over to the other one. She's doing the edge of that. But she's making great use of that burr, using the tip of it. But I'm getting involved a little bit there and letting her know, no, go back to that one. Be a little bit more definitive with it. I won't use the word aggressive. So that's me taking it. I want to show her how to let the burr itself do the work. So I'm doing my touching and lifting. I'm letting the burr do the work rather than me moving it so much like she was doing. So in just those 2 or 3 little lifts there, we got the entire corner out. So I'm going to encourage her to use the burr in a more definitive way that gets more done with each swipe. So she's trying that now. She's doing a great job. She's touching and lifting there on the edge of that nail, touching and lifting. And she's getting some of the skin there at the same time. So she's catching on to how to use that. So that's me again, kind of taking over just to show her that she's doing it right and give her another little encouragement. So now she's getting a little more bold. She's getting more confidence, I guess is a better way to put that. She's trying to make each swipe count. It's kind of the difference sometimes between taking 45 minutes or taking 20 minutes to do the nails. But it all comes in time. You have to get used to these new bits. So she's not moving it as much, but she's back to being a little bit timid. We're not seeing any dust fly off of that and not a lot of headway being made. There we go. Now she's getting a little bit more. She's getting that whole edge off of there. There, she's touching and lifting. So she's getting that edge off of there. She's definitely refining her technique to let the bit do the work for her, but to be a little bit more aggressive with it in terms of getting more nail off with each movement that she makes. There we go. See, she's doing a great job there now. Now she's kind of getting her knack for using this new bit. All right. That was great. We're going to move on to the next bit, which is called a hurricane. The hurricane is my favorite now because it's so versatile. It works really well on skin and thick nails. One question I get asked is about the holes that are in the burr, and that's so that the dust particles from the nail can come and get taken away into the sander vacuum. A lot of dust comes off with this, and you can see it going up into the vacuum sander, but you can use this one with anything. This is kind of a bigger burr than I would normally pick for a small nail like this, but I'm just demonstrating the functionality. I can do those same thinning processes on nails, particularly very thick nails. This one isn't very thick, but this really works well to quickly get the thick nails down and very thick calluses down on the heel or on the sole of the foot, and you'll see that in a little bit. So this is a very versatile burr. Again, it's skin friendly, but because it's a little coarser, you have to be a little more careful about touching it. But you're using it at a higher RPM if you have a sander that will allow you to do that. Maybe 15 or 20,000 RPM. I've seen it used as high as 25,000 RPM. Let the bit do the work, so you just barely touch it, and this is just a workhorse. Let's do some calluses with it. These aren't big calluses. The patient population we have at our classroom or at our class clinic don't tend to have the really thick calluses, but this particular bit, the hurricane, is amazing with some of the homeless and underserved people that I work with that have the really thick calluses. This is skin friendly, so I'm going to keep it moving because I don't want the heat to build up, but you can see I can get all of this off even when it's close to the skin like that without hurting the skin. So you can imagine with thicker calluses, you might press a little harder, you might have the speed a little higher, but it just is amazing without any risk to speak of to the skin. I wish I had some of those thicker calluses, but I think you get the idea here. Here's one on the plantar medial aspect of the first metatarsal phalangeal joint. Oops, I missed that one, didn't I? Well, we're going to the fifth interphalangeal joint. What am I saying? The fifth metatarsal interphalangeal joint. So if you were doing a thicker callus, you would just keep pressing and keep moving it exactly like this until you got down to this level without any fear of it doing damage to the skin. Works very effectively and very quickly. It's becoming one of my favorites. And there's not much there. It's a little pinch, little crevice there, a little pinch callus, so not much to get off there. Here's back to that other one. Sorry for the switcheroo there. Very gentle on the skin. This person, as you can tell, has significant venous disease. You can see all the little varicosities there up higher on the foot. So we want to be very gentle with the skin, and believe it or not, even though this looks kind of dramatic, this hurricane burr, it's very skin sensitive. I guess what I'm doing here, because I'm lifting and a second ago I was lifting and pressing and lifting, I was showing that you can actually do some of that same shortening and thinning with this, even on the larger nails. It wouldn't be my first choice, but you can see that if used carefully, it works. That's kind of the art of working with these bits, is learning in your hands what you want to use for different, different goals. getting it thinner, getting it shorter, getting the crumbles off, that sort of thing. Okay, long taper point. You can see the point at the end. This is another diamond burr. This is much thinner than that narrow cone that we were looking at earlier on. So this will go into those narrower sides. And again, mostly it's press and lift. You're using this also probably at a higher RPM, maybe 20 to 30 RPM. Excuse me, 20 to 30,000 RPM. But I'm doing the same thing I did with that other burr. I'm pressing and lifting to thin that nail all the way down to the skin level. This nail is attached to the skin all the way to the edge, so we cannot relieve that edge pressure by putting clippers under there. It's attached. It would cause the person to bleed. So with this, I'm pressing and lifting to sand the edge of the nail all the way down to skin, and that's the other way to relieve pressure in the margin there, in the sulcus it's called. The diamond burrs are very skin friendly. This is not as coarse as that hurricane we were looking at a minute ago. This is a medium coarse. I'm using it there a little bit on the cuticle. Most of you who know me know I don't do much in the cuticle, but that was a little cuticle area that was kind of rough and sticking up. So I had used it on that toe to kind of just smooth that cuticle off. You would not use this burr or bit to thin a nail because it's too narrow and it would leave little grooves. That's one of the features where this isn't as universal. This is really only meant for little areas. Here was a case that day where the person was actually nipped them a little bit trying to cut that edge off. It was attached. They couldn't do it. So we're coming back with this, and I'm taking that edge off with this long taper point burr. I'm doing just what I did on the edge. I'm just pressing and pressing until that edge is gone. So that was a way we kind of came back to rescue when a clipper had caused a little trauma. We'll get that corner out the same way that we would have with the clipper, but with no trauma. So it's faster with the clipper, but this nail also, the skin is attached. You can't get a clipper under it. All right, this next one is called the Rosebud, and I know it looks a little scary. It's a tiny thing you'll see in a minute, but you can see in that close-up there, it's like a little medieval little thing that scared me to death when I first looked at it. And now it also is one of my favorite burrs. You can see how tiny it actually is. So those little tiny corns and calluses that are nucleated in some way like this, you just press. You're using this at a higher speed also, as much as 30 or 35,000 RPM. And so for the MIH, mechanically induced lesions, for the porokeratosis lesions, those of you that have watched our other videos know what a porokeratosis is. They can be very painful, and they're hard to get out without a scalpel, which most of us aren't using. So I just touch and lift with that little ball, and it is just amazing. I do have to worry about the heat with this. This is a carbide burr, and so it builds up more heat. And that's why I'm really touching and lifting. That's number one, so I can see how deep I am, but number two, for the heat, because this does build up quite a bit of heat. Even though it's tiny, it's very, very what? It has a lot of architecture to that tip, so. There, when I move the light away, you can see how deep I've gotten that. There's no blood, there was no pain. And it will take a long time for that to fill back up, and that person will be comfortable that whole time. So it's much less traumatic than any of the other methods that I've been teaching to do these little poros and little corns. It takes a little bit of time to learn to use it, but not much. Just touch and lift, and mostly that's so I can see how far I've gotten, and for the heat. This does build up heat more quickly. But look what a fabulous job. That dark area there and the one I finished a minute ago isn't blood. That's just how deep it is. That's just a shadow. This is awesome. Nice. That's going to be probably the whole 2 months of comfort for this patient, this client. Now this is one I can't really see. They're reporting pain. So I'm going to take some hand gel. This is a secret. Not really, a little trick anyway. I'm going to take some hand gel and put it on there. And you can totally see the spot that's hurting them. So you could do that with alcohol swab or water or anything. I just had hand gel right there at the table. Now I know exactly what I'm doing. So that's a good little trick for you if you can't see the spot they're reporting as painful. If this wasn't painful, you wouldn't need to do anything. It's not pre-ulcerative, it's not going to get infected, but that person was reporting pain. Different person, and she right under that first metatarsal phalangeal joint has tremendous pain. And we've never been able to get it down very far because it's painful to push on it. But by using this burr at a higher speed, I think I was at 30,000 RPM here, I don't have to really push. I just touch. And the burr, the bit, does the work. And you can see I'm getting all of the 3 kind of lobes of that deep callus out. Look at that. I used a bigger sander or burr, by the way, to get it flatter like this. It was thicker. And once I get the majority of it off, then I go to this Rosebud burr to get in those little deeper areas. And I'm letting the bit do the work. I'm just touch and lift. Again, same reasons, so I can see how far I've gotten, because it does quite a bit with each touch, and to prevent heat buildup. It is just awesome. And that patient isn't moving. It's not painful. When I would try to press with anything else, it would hurt quite a bit. She was waving. Okay, last but not least, the Lamella or saw. It's a carbide burr. You can see it is like a little saw. It's very specialized. And again, it's one I have to admit kind of scared me at first. And now it's another one of my favorites. A little bit more advanced in its use. So these really thick, really tall nails, it would take forever to sand or even to cut off. This is a saw. The Lamella is a saw. It is amazing. So just watch this. So I'm kind of supporting that nail with one finger while I'm pressing with the saw. They use this in manicures even. I'm supporting the nail so it's not pushing it off to the side. That's what you see my finger on the bottom there. And then I'm pressing and I'm moving it for heat reasons. Look at that. It is amazing. I would have been there for 15 minutes and probably hurt the patient because the nail would have been torqued all around with the clipper. While I moved it, it would have been moving on the toe. And that patient just sat there and was totally comfortable. I supported the nail so it didn't move too much. I'm still kind of learning this one. I'm sure someone who's experienced with this could have gone through this even faster. I'm kind of going back and forth like it's a tree. Part of my learning curve, I'll admit. But look at it. It's with no stress, no pain to the patient. And look at that that nail dust getting sucked up into that Aurora sander. Oh my goodness. I'm not having to breathe that. And that's awesome. Look at that. So it's kind of like a tree, I guess, isn't it? You kind of go from different angles till you get down to it. In a second, I think I actually stop a little bit. The heat was building up just as I was almost through with it. So in a second, you'll see me kind of stop for a while and go do another nail and come back to it. But that was for heat reasons. This, as you can imagine, does build up more heat. I'm well away from the skin, but I'm getting the larger part. So those nails that you see sometimes where the nail is 3 inches long and it wraps all the way around to the bottom of the toe, how do you get that off? This is how. It's just amazing. I think that's where I stopped for a second, even though I'm almost done, just because the heat was building up. Let's go on to this one. Watch this. That would have been a lot of effort with any other type of disc or burr. And with this, I'm getting chunks off the time. Look at that dust come off and go down into the vacuum of the auraria. Look at that. I love it. I'm going back to that one and just finishing it off. Boom, that's it. So I'm close to the skin there. I don't want to touch the skin with this one. This one is too coarse to be skin friendly. But you can see what it does. This is just amazing. It's not exactly like a knife through butter, but you get the effect of it. That's the Lamella saw. So I hope this was helpful for you. We looked at the 3 different types of materials and different shapes, and I hope that you incorporate these into your practice. Take care and have a great day.